أهلا بحضراتكم على قناة فكرة في كلمة. النهاردة احنا بقالنا 3 سنين في فكرة في كلمة. 3 سنين قضيناهم بنشتغل مع بعض، نتكلم مع بعض بصراحة في مواضيع كتير بتمس حياتنا. والحقيقة احنا بقالنا 3 سنين بسبب دعمكم القوي لينا، وعشان إحنا دايمًا بنحاول إن إحنا نغيّر ونقدّم أفضل، ونقدّم حاجات أحسن على فكرة في كلمة. عشان كده إحنا قررنا السنة دي إن شاء الله 2026 هتكون بداية البودكاست بتاع فكرة في كلمة، وأنتم اللي هتحكموا لو إحنا ده حاجة كويسة نكمّل بيها أو لأ، أنتم اللي هتقولوا لنا. النهارده الحقيقة إحنا معانا ضيف متميز جدًا، معانا طبيب نفسي من الولايات المتحدة الأمريكية. وعشان كده هيكون البودكاست ده باللغة الإنجليزية، يعني الإنجليزي اللي على قدّي اللي أنا باتكلّمه ده، اللي كلّكم هتفهموه إن شاء الله، ولكن هنكون حاطين دايمًا باللغة العربية في الcaption، حاطين دايمًا الكلام كلّه اللي بيتقال واحدة، واحدة. فابقوا معنا ويا ريت تقولوا لنا رأيكم إيه، وأهلًا بيكم مرّة تانية على بودكاست فكرة في كلمة. Dr. Anthony would love to begin with kind of a quick introduction for you to our audience who are mainly from the Middle East and other countries too, and people who speak Arabic from all over the world.
Well, it's a pleasure to be here. I'm Dr. Anthony Collada. I'm a psychiatrist here in the United States, and I'm happy to share what I know to help those who are watching.
Thank you so much, Doctor. While we've been talking together, preparing for this podcast, uh, you mentioned to me that an anxiety is mostly, I think you said 50% of your daily work seeing patient or maybe more.
It is a high percentage of people that I see and treat, yes.
Do you think the anxiety is going high in our community, Dr. Kalada, due to whatever happening in the world right now, or?
There are so many different causes of stress and anxiety that yes, it's the high amount, and to really identify what could be causing it is incredibly important to help to treat it.
There is a lot of confusion, Dr. Kalada. Even we had a lot of episodes about an anxiety with my knowledge, not a professional knowledge, but I always think when someone can know or can start to think that they have an anxiety from any other psychological pressure or whatever. Can you please tell us in the beginning, how do we define an anxiety?
Yeah, it's a very good question, and I think the answer is a little bit complicated at times. Yeah, I would say generally anxiety or stress, in other terms. Um, there's sometimes anxiety can be something positive and motivating. Sometimes it can be negative and harmful. And when I see it as a doctor, it's usually harmful in someone's life, to where anxiety can present as a lot of worries, like racing thoughts, feeling nervous, or it can come as physical sensations. Maybe someone feels shaking, or they get trouble breathing, or they might feel knots in their stomach, or other physical manifestations of anxiety. And it gets to the point where it's negatively impacting their life. And when it negatively impacts someone's life, such as unable to work well from it, unable to focus on school, maybe their relationships in their life suffer, that's when they really need to get treatment for this anxiety.
So you saying, Dr. Kilada, from my understanding, that someone can start be worried about an anxiety when it turns to physical feelings, when it's translated from thoughts to physical feelings.
Sometimes anxiety can just come with racing thoughts and worries, and sometimes they may not even have that, but sometimes it can just be the physical stuff. So they may be connected, but maybe not. But a lot of times, also when people feel anxious, they may get irritable, they may get headaches, muscle tension, trouble sleeping. So those are some things that we watch out for or look for to see if someone is suffering from anxiety.
So do you think, Dr. Kilada, if someone is having, like, let's say they have acidity or gastric reflux,
Yeah.
right? How do I know if this is an anxiety or coming from my brain or coming from my food?
That's a great question.
Yes.
Actually, they might not be that disconnected. A lot of times, the food can contribute to anxiety. So, for example, if you're eating like junk food or sugars or have a lot of caffeine, that's going to cause anxiety and more psychological symptoms in general. And
Okay.
so, in those cases, removing that from the diet might actually treat the underlying anxiety that someone is having.
Again, to the anxiety definition, we define the anxiety and we know the correlation between the thoughts and the brain and how, and even the food and external environment and how they work together to increase anxiety. But I will go back to the basic question. How do I start to know, like, is lacking of sleep for days and weeks is a sign of an anxiety?
It depends. So we have different criteria of anxiety, and lack of sleep might be a sign of anxiety, but lack of sleep is not specific for anxiety. It could be also a variety of other conditions as well. So the main thing you would focus on are if you notice anxious or nervous like feelings or emotions, or you get a lot of racing thoughts or worries, and you're not able to stop or redirect them. Those would definitely be some concerning signs of anxiety, assuming there's not other like physical problems causing it or drug use or something medically that's happening that's contributing to this.
So we're glad in our Arab world we don't have a lot of drug use, but we have a lot of smokers and caffeine use. So we have a place we call it القهوة, which is basically the coffee. But it's a place when you go and you mainly have coffee, other drinks, but mainly caffeine and smoking, hookah and different kind of smoking. So do you think smoking and caffeine contribute to that anxiety as well?
Absolutely. Caffeine, there's a certain amount that one can have per day. I think it comes out to maybe 250 to 300 milligrams, if I recall correctly. That's average for an adult. But going any more than that, or people that are more susceptible, like are more likely to get anxious, may have to go less than that, or they may get anxiety. Or the smoking, yeah, there's some benefits and that can help people focus and concentrate in the short term, but certainly the withdrawal from it can lead to more anxiety. And also, it might just be an unhealthy habit people use to help manage stress that could be contributing.
You mentioned to me one day while we were preparing in one of our preparation session, you mentioned to me that you can know an anxiety if you cannot do your daily routine or you notice a huge change in your way of living, in your relationship. Can you elaborate more on that, Dr. Kat? Because this
Yeah.
was actually one of the points I love it so much.
Yeah, I mean, exactly as so you described it. So anxiety might not be anything problematic if it's not affecting our life. But when we notice it affects our ability to work or affects our focus in school or it affects our relationships with others, that's when it's an issue that needs to get treated or needs to be addressed. But sometimes if you're able to stop it or manage it before it gets to that point, then it's not really a clinical anxiety that you necessarily need help from a psychiatrist like myself to treat.
We're gonna move on to to how we deal with anxiety. But before that, I just want to summarize for you very quick what we've been talking here with Dr. Kalada. So we talked about the definition of an anxiety and how we know that an anxiety. So Dr. Kalada, you mentioned an anxiety might be something good or something bad, and when it's bad, it affects the body. It affects our. It can be start with thoughts and a cycle of vicious thoughts that keep coming, keep coming, keep coming, and you cannot get rid of those thoughts. And then this can affect your body physically by maybe having some trouble breathing. People have some trouble in their gut, in their stomach, in even their muscles, or even their sleep, and so on. And also, we talked about a very simple sign to know an anxiety that you are heading to an anxiety, defying the routine, your daily routine, or you cannot do it no more, or you change in your relationship that you may be becoming very angry at home or want to be alone. Does this summarize what we talk about? Is there anything I said wrong? You can correct me, Dr. Clara.
Yeah, that was pretty accurate. Yeah. The as far as the daily routine, it's more our level of functioning. So maybe we're at some sort of level at work, but we're not able to reach that anymore because we can't focus or concentrate on the task, or worrying a lot about something else. Or maybe, as you mentioned, we have good relationships with like our family or friends, but because of the anxiety, we're getting more irritable or short-tempered with them. And so, yeah, at that point, it needs to get help for it.
Do you think, Dr. Kalada, the time play a role here? How long do you think that if I will keep having those symptoms we talked about, for how long I should start to deal with it as an anxiety?
Well, there's not a specific time frame for most anxiety issues or questions. It might sometimes, for example, someone may lose a job and they're under financial stress, and that might cause anxiety right away. And that could be just after a few days after losing the job. Other times, it may be something like genetic, like their family is more, for people in their family are more likely to have anxiety. And so the person is more likely to get anxiety themselves. And that might be something that lasts months, years, maybe their whole life. So the time frame may or may not be as important, but what is important is how one's life is being affected by it. Because someone may have a sleepless night and get worried or anxious, but they're still able to function in their daily life and it doesn't affect them as much.
Yeah.
And so that
There is no time, there is no fixed time frame or scientific studied time frame of episodes happening so I can start looking for help.
they do for specific conditions. For example, I don't know if you want to know about the specific conditions, but generalized anxiety disorder would be at 6 months.
Yeah, this is very helpful.
With a certain amount of other symptoms. They may also get muscle tension, difficulty sleeping, problems concentrating.
Yeah.
You could get other anxiety things that happen maybe just because of the stress in one's life. And so that time frame would be maybe within 3 months of the stressful event, but not more than 1 year. But during that time, they may get anxiety. Sometimes there's conditions like when people have been around like traumatic episodes or a victim of traumatic episodes that can cause anxiety, and that time frame for that is maybe within a few days from the episode to months after the episode. But those are more for the doctors or clinicians that are providing to put them and people in little
Yeah.
like boxes or labels
Yeah.
to help treat it.
Yeah.
But oftentimes people don't really fit these labels, that everyone's sort of unique,
Yeah.
has their own life experience.
But we can say that the bottom line, if you can feel an anxiety for a long time or the symptoms of an anxiety for a long time, you have to look into it a way or
Yes.
another,
Yeah.
right? Because unfortunately, in our countries in the Middle East, most of the people doesn't have the luxury to go visit a physician or a therapist to go through it, right? And this is unfortunate, but this is where I'm coming from, and we know how things works. That's why I keep asking those questions, trying to self-identify things, and I'm sure that seeking help is the way to go. Yeah, absolutely. But I'm saying if someone cannot afford, so they can have an idea and look it up or something, and then look for help.
And actually, that's one of the motivating factors that I did my YouTube channel, is so that I can educate people about anxiety, the medications used for anxiety, also the ways to address it without medications, because there are several options out there for people.
That's amazing, and that's very helpful. Thank you so much. So, an anxiety can be caused by thoughts, or they can be caused by physical things or medical condition or
Yeah.
drugs. Can you elaborate more on that, please, Dr. Clara?
Yeah, that's right there. So it's important to actually get screened for the medical causes, make sure you don't have medical causes that are causing the anxiety. And we initially look for like the physical causes, like the medical conditions. For example, low blood count, which is known as anemia, can lead to anxiety. And that may come across as racing thoughts. It may come across as physical symptoms. Just really depends on the person. But you won't really know it unless you get this blood test done by a doctor to know. Sometimes there's a hormone in the body called thyroid. And if thyroid levels are too high, and the body might just unfortunately do that on its own, basically with no control someone has over that. But if thyroid is too high, that can lead to anxiety. Certain medications, in particular steroid medications, which people might use for a variety of physical reasons, that can lead to anxiety. Even albuterol inhaler, which is often used for asthma, can cause anxiety in people.
Okay.
So those are some of the medical conditions. And then there's a lot of other physical causes that, like maybe someone has genetics from their family, more likely to cause anxiety. Maybe someone's drinking too much caffeine
Yeah.
or smoking.
Yeah. So now we're going to move on to the next step. If I know I have an anxiety, and this would be a tough one because I know you're a doctor, right? And you're treating patient daily. But from my experience with people through the last 2 years, a lot of people from the audience send me questions. And when I say that, guys, I'm not a professional, you can go seek someone who's professional on that. And they are either or ashamed. They don't want to go to psychiatric because in the Middle East, before I don't know about now, but when I grow up a long time ago, people think when someone go to psychiatric, they think they're crazy, right? Or they cannot afford to go to a doctor in those days. So it's a cultural barrier or a kind of financial barrier. So first, can you talk us through people who have money, but they just don't want to go to a therapist or a doctor to get treated because they are ashamed? Do you have any advice for those people?
Well, yeah, I would say it's not, sometimes it's almost a strength to get help from others and not a weakness. And I know there can be a stigma about being on medications or needing help to get through a problem. But when you think about, we all really need help in everything that we kind of do in life. So it's almost, I would not see it as a form of weakness as much as it could be something that's necessary or helpful in someone's path for optimal health and healing. Now, there are many avenues to try to treat the anxiety or the racing thoughts or even the physical symptoms without seeing a professional. And by all means, if someone is able to live their daily life, they should try those means
First.
yeah.
Yeah.
Not everyone really needs to see a
And this was my second part of the question when I was trying to ask you about people who cannot afford to go to see one. In this case, uh, what are the due diligence or what are the things that are easy and available for everyone that I can try? And I understand that any advice coming out this episode is not a substitution to go seek professional help. Yes, I this is the disclaimers, and I need to say it for everyone. But on this side, Doctor Kilada, we want to hear from you the things that we can do, any one of us, when we feel that we are anxious.
Sure.
The first.
Sure. So one thing you can do is focus on your breathing. And I'll explain why. Because when someone is anxious, their mind and their body is in this fight or flight mode. They either want to get in this, their brain is in this state where they just want to run away from the problem or run away from things, or they freeze and don't know what to do. And that will secrete these hormones in the body, and the body responds to it in a certain way where if someone, as I mentioned, breathes fast or gets shaky, maybe they feel lightheaded or dizzy. So those could be signs of anxiety. But you can change your body's response by focusing on your breathing. So if you take slow and deep breaths, so you're not worried about, what's happening there, but you're really focusing on your breathing. That's one thing you can control physically to try to slow down the anxiety.
You're talking about more of a meditation thing, right?
Yeah,
Like
more
taking your brain from those thoughts,
yeah.
right, to breathing.
So that, yeah, it's more, some people it's like a meditation, some it's actual physical, just focus on the breathing.
Yeah.
But there's other techniques, like there's a technique called 5, 4, 3, 2, 1, and where you're using your senses to focus on something that's like happy or something that's in your environment. Because a lot of times when someone feels anxious, their thoughts are not right. It's like not making sense, or it's irrational, or maybe they think about something in the past or think about something in the future, but try to being in that present moment. So the 5, 4, 3, 2, 1 technique is maybe focus on 5 things you can see, like maybe it's these lights or this chair, or if you're outside, maybe it's like the blue sky, the trees, or the buildings around. And then you could do like 4 things that you can hear. Maybe it's like the noise, or birds chirping, or 3 things you can touch, 2 things you can smell, and then 1 thing you can taste. So that you use your senses to try to focus on something in the environment or something that maybe is uplifting in your thoughts.
And for how long, Dr. Kilada, I think we should do that?
You try it out to see how long it helps to with the decrease the anxiety. Some people might take seconds, minutes. If it takes any longer than minutes, then maybe there's something else that might be more helpful, like going for a walk, or something that helps distract. Yeah,
I heard that when you breathe, you can stimulate the vagus nerve
exactly.
at the floor, the abdomen,
Yeah.
by pushing your breathing through your stomach. And if this is true,
So, there's the vagus nerve, which activates the parasympathetic nervous system, which is the nerve. Like when you eat a big meal, you may feel tired or just want to sleep. You feel relaxed. So that's the vagus nerve doing that. That's the parasympathetic nervous system. So when you focus on your breathing, you're basically trying to activate that system. Because when you're anxious, it's the other system that's activated, the sympathetic nervous system. That's the one where you feel like you're wanting to run away,
bad
you're
guys.
scared. Yeah. So it's bad if it's too long or too intense.
But if it's for some moments, it help you save your life.
Right. If you have a wild animal
Yeah.
chasing after you, that's you want this system active. You don't want this one active.
Got you. A side question, and it just came to my mind here because sometimes when we are stressed, we lean on food. We lean on the eat more and all those things, gain weight, right? Is why? Because the food, when we gain weight, we stimulate the vagus nerve, or this is not related?
It might be for
Yeah.
some people, but it could also be there's some emotions or unpleasant feelings
Okay.
that we're wanting to cover up.
Okay.
When actually it might be important to explore those or to understand why we're having those. Or
Dr. Kalala, final words about an anxiety before we close the episode today.
anxiety is not necessarily a bad thing. It could be something that's helpful and useful. It could be something that encourages or motivates someone to get things done. It could be maybe a protective mechanism that someone has. But also, if someone is really suffering from very bad anxiety, it is important to get help and to try to address it in a healthy way. And hopefully, I'm sure this series and this podcast will help people to understand it and deal with it more. And also on my YouTube, I have an anxiety playlist, and I talk about not only medications, but non medication options, which people can do from their own home to help with the anxiety.
So that's actually great news that you guys will have Dr. Kalada series for anxiety, the link in the description down here. And this is gonna be a great way that you can, if you are interested in the topic, if you feel like you might be anxious, like a lot of people, so you can go to this and check it. And this will conclude our episode for today about the anxiety. We are going to see you next month, after 30 days exactly. Keep watching. I think an anxiety, if we know about an anxiety and we can deal with it, this can change our life.
Oh, yeah, absolutely. It can help you uh, manage it better, get it identified better, yeah, deal with others better. It's definitely important information to know.
That's great. Thank you so much, Dr. Kilada, for being with us tonight. I really appreciate your time, your dedication for our audience from all over the world. Thanks. Thank you again. And I hope we're going to see you next time.
My pleasure. Thank you, Mark, for having me.
Thank you.